Now we're going to discuss the underlying causative factors that can result in the epileptic seizures in the individual. So there can be multiple factors. The causative factors that come from within the patient, it can be the environmental factors that can contribute towards the development of the epileptic seizures in the individual. So these are basically the multiple causative or the underlying factors that we're going to discuss over here. Now, you must be well aware that the neuronal outburst that occurs in the patient as a result of the epileptic seizure, it can be due to the genetic factors that are present out there. It can be the infectious states that the patient might be suffering from. For instance, it can be the meningitis or encephalitis. On the other hand, we're also going to focus on the particular history of the head trauma in the patient. So the history is very important to highlight the etiological factors over here. Then obviously the clinical examination also plays a very vital role over here. That is basically going to highlight specific points. For instance, if we carry out the cranial nerve examination, that is going to give you the exact idea what part of the cortical region is involved in a particular patient. For instance, if the frontal lobe is involved, the patient usually experiences a particular aura that might be seen. For instance, the abnormal sensations or the abnormal hearing of the sounds and even the loss of consciousness is observed in the patient. Then obviously, if a particular motor area is involved of the cortex, that is going to result in a separate set of symptoms in the individual. So it is going to depend upon the cortical area that is involved. That is going to give a unique picture of clinical presentation for that particular patient about whom we are talking about. The causative factors can be different for the different age groups. So a very simple way for the classification over here is according to the age group that we're going to deal with. For instance, if we have neonates, and neonates is basically the child age group less than 1 month. So this is the age group that has the separate causes over here. The history would even highlight the definitive causes in this particular case. For instance, it can be the perinatal hypoxia and ischemia that is noted down. And if there is a particular history of hypoxia and an ischemia in the patient, we're going to highlight that even over here. So this is the particular history that we're going to focus on. You're going to ask what kind of a birth history or what kind of labor the child has or the mother has undergone when this particular child was born. And that is going to highlight the causative factors or if there has been any chances of hypoxia noted down. Intracranial hemorrhage and trauma. It can be noted down, and if basically the child has any history of this kind of a hemorrhage that happened or any birth trauma or head trauma that the patient has undergone. CNS infections, for instance, meningitis and encephalitis are to be seen for this particular patient. And then obviously we're going to also note down the metabolic disturbances in the child. Drug withdrawal, so drug toxicity and any sort of drug allergic reactions that the child has undergone, you're going to note that down in the history as well. Developmental disorders are also going to be seen. And if these developmental disorders are pointing out towards a specific pathophysiology, you're going to note down that as well over here. So this is the complete causative factors that can contribute towards the neonatal epilepsy. And obviously, you're going to highlight these factors when you are focusing on the history taking. Particularly, the corroborative history is going to be very important over here, and you're going to focus on this corroborative history while you're taking a neonatal epileptic or seizures in hand. Genetic disorders are also going to be considered over here. One thing that I'd like to mention is that a lot of children, they suffer from febrile seizures, seizures associated with a high in temperature. So basically, a rise in temperature is basically narrating the fact that the child is suffering from some sort of an infectious state. So you're going to even focus on these facts over here, that whether the child is suffering from some sort of a rise in temperature or not, because that can be one of the major cause over here in the neonates, which basically results in the febrile seizures in the children. Now, the infants and children more than 1 month but less than 12 months, they have their own causative factors over here. Febrile seizures is again one of the important causes over here, and you're going to basically focus on the rise in temperature. The clinical examination, taking the vitals is very important over here. You focus on the respiratory rate, you focus on the blood pressures as well as the temperature rise as well. Genetic disorders or any sort of genetic disturbances that can be evaluated over here. Then we have the central nervous system infections are sometimes also seen in such patients. Then we have the developmental disorders that are usually observed in these particular individuals. Trauma and what kind of a birth history the patient has. Was it a difficult labor? Was it a prolonged labor? All of these are going to be highlighted over here. And even after this labor history, you're going to ask for any sort of a head trauma that the patient has suffered. And you're going to highlight that in your history and document that completely over here. What kind of a treatment the child got, and what was the emergency treatment the child got, and what were the signs and symptoms after that particular trauma history. You're going to document all that in detail over here. Now, the adolescence. So we have this peculiar kind of causative factors, or the particular classification in which the child has a normal infant history. He or she didn't suffer from any sort of seizure activity before that, but after reaching the adolescence, almost 12 to 18 years of age group, he or she might suffer from some sort of a seizure activity. So what can be the causative factors over here? You're going to highlight that over here. Trauma is one of the major history that you're going to focus on. Then any sort of genetic disorders that the patient might be suffering from, particularly the infectious states that the patient has suffered from, and then obviously the drug toxicity and the illicit drug use that you're going to focus on over here. And then obviously any sort of tumorous conditions that the patient might be suffering from. As we even saw in our case study, the patient belonged to this group of infants and child when she suffered from the seizures for the very first time. That was at the age of 7. So what can be the causes over there in case of Sarah? It can be the febrile seizures. It can be the genetic disorders, either the CND infections. It can be you have to take the history of developmental disorders over here and highlight any sort of traumatic history that the patient had before that particular age group that he or she might have reached. So this is very important that you focus on these particular age groups and then sort out the causes in detail over here. Then the young adults, that is almost the age group of 18 to 35 years, you're going to focus on the traumatic history. Alcohol withdrawal is one of the major cause for this particular age group, and illicit drug use, you have to highlight that if the patient has suffered from any sort of. Then we are going to also look for any sort of history that is relating to the brain tumorous condition or the neoplastic or the paraneoplastic syndromes that the patient might be suffering from. Autoantibodies is one of the causative factors over here. Then we have the older adults, in which the age group is almost more than 35 years. It can be the causative factors over here can be the CVS diseases. So any sort of cerebrovascular diseases that the patient is suffering from can result in this particular kind of the epileptic seizures. Brain tumor is one of the causative factors over here. We have the alcohol withdrawal, and then the metabolic disorders can be one of the causative factors as well. Alzheimer's disease and the other degenerative central nervous system conditions can also contribute towards the development of these epileptic seizures as well. Autoantibodies is another very important cause that we can take into account over here. A lot of drugs, as I was already focusing on, they can also contribute towards the development of this particular condition over here. So what are these drugs? Namely, we have the alkylating agents. We have the antimalarials, for example, chloroquine, antimicrobials or antivirals. Anesthetics and analgesics can also contribute towards the development of seizure activity. A lot of individuals are hypersensitive to any of these groups, and they can develop the seizure activity, or even the illicit or the overdosage of the drugs can result in the epileptic or the seizure activity in the individuals. Dietary supplements sometimes produce the seizures, and then we have the immunomodulatory drugs. Psychotropics, again, I would like to focus on the fact that the history is very important. You basically focus on these different points, what are the medical conditions that the patient has been suffering from, and then you can really sort that out, that what kind of drugs the patient might be taking, which can really contribute towards the development of the seizure activity. Radiographic contrasting agents, and then we have the drug withdrawal. So the use of illicit drugs, and after that, the withdrawal of these drugs can result in these particular withdrawal symptoms that can mimic the seizure activity. Drug of abuse are also taken into account over here. And then we have flumazenil, which is basically an antifungal drug. So all of these can basically be sorted out when you are taking the history from the patient, and if the patient has been on or has been prescribed with any of these group of drugs, you're going to highlight that in your history, because that can be one of the major causes towards the development of the seizure activity.